When a person is having a stroke, every minute they're having the stroke, 2 million brain cells die. So they need to be treated as soon as possible.
Hendricks has done a fair amount of education in the community about recognizing the warning signs of stroke.
If you think your loved one is having a stroke, think FAST, F-A-S-T, facial drooping. So if they have trouble moving their face, that's the F. The A stands for arm. Often in a stroke, the arm will become weak or numb or tingly. Their speech may become slurred. That's the S in FAST. And T stands for time.
Our emergency department is cardiac and stroke accredited, so we're able to care for those patient populations as well as anything else that would walk through our doors.
The American Stroke Association recommends that a hospital give TPA within 60 minutes of arrival to the hospital.
One of the issues we had here once we got below 60 minutes was how do we go from good to great?
Telestroke is something really unique that we're doing at Hendricks Regional, and it's something that was pioneered by Scott Klein and Jim Nossett and some doctors out in Virginia.
I actually reached out to one of the coordinators at University of Virginia and talked to them about their protocols and basically said, we're going to build ours and we'll compare them to yours and see how we can work together. Kevin Spear basically said, can you give me a good reason not to do this? And I couldn't come up with a good reason not to. And so he said, it's all yours, go for it. And so got in touch with Dr. Nossett and the ER group and ran it past them. And then next step was getting EMS to buy in. We took iPads using FaceTime app, put one iPad in the ambulance, the other one in the ER, and that allowed the ER team to assess the patient en route as opposed to wait until they hit the door of the ER so that after the CAT scan we can get them treated almost immediately.
We can evaluate that patient before they get to us, and they can get treatment several minutes sooner than they would have had they not had that program.
So it's something that you're not going to get at any other hospital in the state of Indiana.
I'm very proud of the way Telestroke came up through our system. If you live here in Hendricks County and you're having a stroke, we're reducing the amount of time between diagnosis and providing life-saving medication, not by a few minutes, but by a considerable amount of time.
We've been able to reduce our door-to-needle time from 55 minutes, which was already pretty good, to in the mid-30s, which is really good and really unheard of. The original pilot portion of our mobile telestroke program started in Plainfield. We used Plainfield on purpose because they were our furthest EMS community that services our area. And so they gave us enough time in terms of drive time, to be able to sort out any kinks that might come up. Then we took it to the other communities.
Avon, Brownsburg, Danville, all either have or will be getting the ability to monitor a patient electronically in the back of the ambulance from the emergency department using high-definition cameras.
Rollout is actually pretty easy once the technology is in place. My hope in terms of next steps for the mobile telestroke program is seeing if there are any other communities that really need this service. There aren't a lot of neurologists in Indiana, and so sometimes it's difficult to get to one quickly if you're outside of Indianapolis and some of the bigger cities. And so if there are areas west of here or north of here that may need our help, this would be a good way to reach out to them and offer that service. It's so exciting to do this here at Hendricks because it was started here. Frequently when programs at this level are rolled out, they're rolled out in an academic center and then we attach on once it becomes standard of care. It's been nice as a community to see everyone who touches that patient, from the EMS paramedic to the emergency room nurse and physician to the neurologist and beyond, all be a part of this, and then using technology that really isn't used anywhere else in this setting to build something that no one else has and deliver patients care that much more quickly has been wonderful to see.